but I'd like to share some good news. We will soon be able to distribute $300 million in federal CARES Act funding to our local cities and counties. And we're very happy about getting that distribution going. We'll be announcing the specific allocations in the coming days, and the funds should be dispersed in a few weeks, pending approval from the legislative leadership. This is a good start, but we have to realize that the needs of these communities are much greater than will be satisfied by this original act of Congress, and we know that they will have severe budget shortfalls. I talk to mayors and executives fairly regularly about this, and they and the state are most hopeful that the Congress will continue this trend to keep us going. Contrary to what some senators have said, bankruptcy for any community should not be an option. And the reason is these cities and counties are really on the front lines of the pandemic. They're the ones who are carrying the burden of emergency services. They're going to be involved in our contact tracing effort so we can find people that may have been exposed to this virus, and they simply have to have the wherewithal to get this vital work done. Now, turning to recreation. Today I'm joined remotely by Commissioner of Public Lands Hilary Franz, by Kelly Susewind, Director of Department of Fish and Wildlife, Don Hoch, Director of the Washington State Parks and Recreation Commission, and by my Senior Policy Advisor for Outdoor Recreation and Economic Development, John Snyder. They're joining me today because today I am announcing a partial reopening of outdoor recreation beginning on May 5th. This will open up widespread outdoor recreation, assuming healthy and safety guidelines continue to be used by Washingtonians. Based on the data that we have now received, we are close to the point in the spread of this virus where we can enjoy the outdoors again. This is a data-driven decision. It is a decision that follows the data because that's what we need to lead in these efforts. I do want to emphasize that this is a decision we make today, but if this virus were to spring back, we might have to roll back some of these measures again, which is the reason we have to remain disciplined in how we do enjoy the great outdoors. When I rolled out the Stay Home, Stay Healthy in March, I did so because we knew that reducing movement and reducing the physical interactions that would take place ultimately would reduce the spread of this virus and ultimately save lives. And it's why we made very difficult decisions to close state parks and public lands and golf facilities and delaying hunting and fishing seasons. Those are tough decisions knowing how important outdoor recreation to us here in Washington State. But we do know that outdoor recreation is one of the best things people can do to promote health, both physical and mental, during this time of stress and isolation. So the restrictions being lifted today include day use of our state parks, day use of our state lands that are managed by the Department of Natural Resources, and day use of state fish and wildlife areas. This includes fishing, hunting, and the ability to play golf as well. Now we do know that all of these activities do need to be done with appropriate social distancing, as well as protocols for safety and security of everyone enjoying the outdoors. And just as with other sectors where we are beginning to modify our restrictions, if we were to see a sharp uptake in people who are being affected, we'll have to modify these activities again. Aside from today's announcement, any additional relaxing of outdoor recreation restrictions will depend on the data and our compliance rates. But I do think it's important to say this. This is not a return to normal today. The virus is too rampant to allow that. This is only a beginning of a phase of relaxing our outdoor recreation. And if it's hurting our public efforts, we'd have to change course again. Data, not dates, determine how we act. It's like someone who has a plan to go hiking. They've got their boots already, they got their compass, you got your backpack. It's a plan, but you can't do that till the snow retreats from the hills, and that's up to Mother Nature. We have a plan for reopening our state, but it depends on how the data comes in regarding the progress of this virus. So today, public gatherings, events, team sports, and a camping, or among other things, are not resuming at this time. That means if you're on a park, loved ones and your pals from getting sick. We know that when we're on our trails, good etiquette is to step off the trail and give people at least 6 feet. It matters, even in the woods. So it is important to say, too, that today's action does not restrict the ability of local governments to maintain restrictions on their own, in their own jurisdictions as they deem appropriate. And of course, this includes tribal lands as well. I'd like to emphasize that we're making this decision based on public health all the way around. Now, these are guidelines that we all need to follow in outdoor recreation going forward. And it includes a prohibition on anyone exhibiting any cold or flu-like symptoms from participating in these activities. People need to limit their partners in recreational activities to only those who live in the household unit. Having the symptoms is a dangerous sign enough not to engage and infect anyone else. We also need to recreate locally to the extent humanly possible. We should limit unnecessary travel and not make overnight trips to recreate. It's created too much stress on some local communities who are otherwise stressed and would be overtaxed by an influx of too many people. So bringing your own food and supplies when possible is going to also help reduce exposure and help these local communities. We know we need to avoid crowds, even outside. I've seen pictures of a couple hundred people at a trailhead at the top of a mountain. That's just too dangerous. We can use face coverings when social distancing is not possible. We got to wash our hands outside as well as inside, and always got to pack it out clearly. We've been working with the Golf Alliance of Washington the last few weeks on guidance to provide appropriate social distancing and limiting when playing golf. We'll be playing in twosomes for a while, except for when a foursome is all one household. And we always obviously have to socially distance even on the course. So you can only play golf with one person from outside your own household, and we still need to socially distance. Now, it also means, and I hope people think about this, it also means we really can't be traveling in the automobile with our friends who are not in our household right now. And it's the same thing with being in a boat. That being confined in a vehicle is just too dangerous at the moment. When we play golf, we're not going to have sit-down or beverage service. Have to find another avenue. Now, this announcement follows another great example of groups and individuals working together to ensure that our activities can be safe, and that's what's happening in the face of this pandemic. As I've said before, this virus and the impact on all of us is extremely challenging. But this is not the time to give up on the strategies that we know are giving us results, saving lives in the state of Washington. And I'm confident that Washingtonians who love the outdoors as much as I do are going to do a good job maintaining social distance even when we're outside and just exercising common sense for our own good and our loved ones. I want to thank the millions of Washingtonians who are doing that across the state. And I now want to turn to Commissioner Hilary Franz and others. Hilary.
Thank you, Governor, for your leadership and for this opportunity. Obviously, people of Washington have made great sacrifices in the fight against COVID-19. One such sacrifice felt profoundly by those in Washington state, our residents, is the closure of our public lands, our state parks, our recreation areas. We know in times of crisis that our public lands and natural resource areas are a place that we go to for our physical, our mental, and our emotional well-being. So it was one of the hardest things to have to close those lands to the people of Washington. But thanks to the shared sacrifice of everyone and the heroic work of our first responders, our doctors, our nurses, we we are able to take steps today to reopen our public lands. And I truly believe that reconnecting people with nature is the first step in a long journey to back to normalcy. However, we need to make sure that in reopening our public lands, we do not in any way get so lax that we have a return of this problem. And it means that we have to be vigilant in the fight against this virus. We all need to take steps to make sure we continue to do as much as we can to keep our families, our communities, our first responders healthy. And that means to recreate responsibly. Before you leave, make sure you prepare, that you have hand sanitizer, water, a mask, that you make sure when you arrive you avoid those crowds and you definitely utilize social distancing rules. Unfortunately, the reason we had to take steps to close our public lands is because we saw an unprecedented number of people coming out and enjoying our natural areas. We want to keep them open. We want people to enjoy these areas, especially now. But that means we all have to take actions to make sure we're keeping ourselves safe and our families and our communities safe. Thank you again, Governor, for your leadership, to the Department of Health and all of our first responders, our doctors and our nurses and community members on the front line. We look forward to getting back to normal as soon as possible. Thank you.
Thanks, Hilary. We know these are difficult decisions for all of us. Kelly, our Director of Department of Fish and Wildlife.
Happy to be here with you today to reopen our public opportunities beginning May 5th. Specifically with DFW, we'll be opening our wildlife areas and boat launches, and we'll also be opening most of our seasonal fishing and hunting seasons, consistent with what is normally open at this time of the year. There are some restrictions. There's no camping allowed on our land, and we still are working with local officials and health professionals to reopen the coastal areas. So Marine Area 1 through 4 will not be open for fishing yet, nor will clams or shellfish. Working hard to get those opened up as soon as we can, but they will lag behind the May 5th opener for the rest. I really want to thank everybody for your patience that have stuck with us. We know that this is a sacrifice that caused these delays as we all fight to stop the spread of COVID. We particularly appreciate the dozens of recreational community groups and leaders that are working with us daily to develop the steps to get back out safely. For us specifically, safely means continuing that social distancing. We ask that you recreate with members of your household. We ask that you recreate locally. So for us, we did not define a local term. We're asking you to basically stick with day trips. Basically go out, be prepared, bring that sanitizer, hand sanitizer with you. Take everything with you need so you can leave your home, go out, recreate, come home, and not have to engage with anybody beyond your immediate group. If you arrive at your location and it's crowded, please find another place to go. We're asking folks to recreate responsibly. We know you can. We're in it together. To our hunters that can't meet those guidelines, so I'm thinking spring turkey and some of our spring bear hunters, if you can meet the guidelines, go. We wish you the best of luck. If you can't, contact us. We'll make sure to make it right for you. We're refunding license fees. We're reestablishing preference points for our drawing. We want people to recreate safely, and when you can't, work with us and we'll make you whole again. I look forward to seeing you out there on the trail. Thank you for recreating safely.
Thanks, Kelly. Don, our Director of States Parks and Recreation.
Thank you, Governor. Thank you for your leadership. Good afternoon, everyone. I'm pleased that we have reached a point where Governor Inslee feels comfortable beginning to reopen our parks and public lands. The Governor and other public land agencies recognize and understand the importance of the outdoors on our health and well-being. This important step will provide the public the opportunity to reconnect with nature, reduce some of the stresses of being confined in our homes, and instill a little sense of normalcy back into our lives. As we prepare to reopen our parks, we've taken steps to ensure the safety of our staff and visitors. We've also been working with our local communities and tribes to address concerns they have reopening park day use areas. We want to avoid crowds flocking to the ocean beaches and popular parks and trailheads, putting these communities at risk. For this reason, we're not opening every park and are working with our partners to determine the best approach and timing for reopening them. We we ask that the public be responsible when visiting our state parks. Follow social distancing practices. Come prepared with personal hygiene products. Avoid traveling too far. And most importantly, stay home if you're sick. I'm confident that we can enjoy the outdoors in a way that is safe and responsible. But that needs everyone to work together to accomplish that. The state park staff are looking forward to welcoming you all back to your best managed state park in the country. Thank you, Governor Inslee.
Thank you. And with that, happy to stand for questions.
First, we'll go to Rachel with AP.
Governor, you said that today's announcement doesn't reflect the state's ready to fully reopen. Do you plan to extend the current stay-at-home order to the end of the month, as the Bay Area did today? And then secondly, going back to the federal stimulus comments you started with in regards to government, as you know, state revenues are projected to drop dramatically, and there are concerns about potential cuts to state programs. How do you think the state should address that potential shortfall if the federal government doesn't come through with enough money to bridge the gap?
Well, we are hopeful that the Congress will step up to the plate. We are hopeful that the Congress understands the centrality of states and cities and counties providing fundamental services. Look, these are schools, these are a state patrol, these are contact tracing and isolation programs to fight the virus. This is the absolute front lines. And so we are hopeful that Congress will give it another large infusion to the states so that we can continue these vital, absolutely essential services. And we are hopeful that Congress will roundly reject Senator McConnell's suggestion that the way to deal with this is to allow states go bankrupt. That is the most wrong-headed, ludicrous idea I've heard for a long, long time. So we are hopeful that the Congress will come through. We've had a diligent delegation for us in Washington working on this issue, and I hope that they are successful. Now, to some degree, almost perforce, no matter how successful Congress is, we are going to have real challenges in our state in the billions of dollars. And we need to know, as with all of our data, how big that hole is going to be. We will have a beginning of a look at that towards the end of this month when we get some preliminary forecasts about the revenue that's coming in. But I don't think you'll see a plan for several weeks about the best way to approach that. And that's when we'll be able to plan in that regard. Your first question was, I promptly forgot. Progress in the last few days, and we have opened up ongoing construction. We've been able to open up outdoor recreation today, and as time goes on, we intend to continue to turn that dial to open up our community. But that dial depends on data on when it can be opened up, and that data changes every single day. And we watch multiple metrics. We watch the percentage positive. We look at the daily hospitalizations for COVID-like illnesses. Of course, we look at our fatality rates. We look at the percentage of people who come in with COVID-like illnesses. And we look at the modeling that projects what the situation will be in the future. And what we have seen is that we've had some modest improvement in this regard, but the models still give us great pause and have not enough confidence to throw open the gates to return to all of our normal activities. Nor have we reached the threshold that the White House even suggested regarding reduction of infection rates. So we will have to maintain a significant part of our effort after May 4th. We have not made decisions on further dates after that. That'll be data-driven, and we'll have more to say in the next few days.
Next question comes from David with the Seattle Times.
What specific metrics
We lost you there, I think.
Sorry, can you hear me?
Yeah, that's better.
Yeah, what specific metrics did you see that told you it was okay to open public lands? And what might be the next thing that could open if those metrics continue in the right direction?
Well, there are not quite dozens, but probably a dozen numbers that we look at on an hourly and daily basis. I'll just show you one of them that you might find of interest. I'll put a graph up, and this graph shows the cases of COVID-19 hospitalizations by date of first admission. And of course, it starts in February, spikes, we hope a spike. Some of the numbers have come down, and we're in this range here in April today in our hospitalizations for COVID-19 based on date of first admission. Now, this is just one metric that we look at, but if you look at this metric, it would suggest that we have made progress. These admissions went up fairly significantly, and the admissions have come down to some degree. So that's one data point amongst many, and I almost hesitate to show you this one because there are other data points that are not as sanguine. The percentage of positive tests, the numbers of infections per day, which have, in some manner of speaking, plateaued, that doesn't look as rosy as this chart does. There are many data points, but this is just one that is at least one cause for some glimmer of optimism. But I'll show you another graph to show why these decisions are difficult and why we need to make them based on sort of a rational, calm thought rather than ecstasy, thinking of we're out of the soup here. This is a projection by the Institute for Disease Modeling, and it shows our past experience and then some projections. Basically, it starts in February. It shows the dates, and this is for King County. So this is not a statewide chart. This is for King County. And you'll see the data points, and this line you'll see has gone up, and to some degree has plateaued, as I've indicated. And the modelers have used their best algorithms to project what that looks like in the future. What they have projected is if we continue our social distancing, the model would be just a little bit downward on this green line. Just a little bit downward, but not much. Pretty much a plateau. This model is not as, obviously, is not optimism. It does not produce as much optimism as the one data point that I just showed you. There's something also very significant in this model, is that they have modeled what this would look like if we remove our social distancing requirements right now. And this is demonstrated by this gray line that starts to go up quite dramatically. And the thing that grabs my attention in this model is the rate of that increase. You'll see the rate of increase is demonstrated by the angle of attack, the angle of this gray line. You'll notice this is darn near as steep as when we began this effort, which would suggest that if we gave up today, we would be right back in a similar situation that we were earlier this month and in March when this thing was rampant. So these are just two of the data points we look at when we made this decision. We think we are now at a point, we've been looking at this very carefully for a couple of weeks now, where we do think some small changing in that dial is appropriate. But we are so far apart being able to turn this off like a light switch. That is just way too dangerous. We'll have more to say about some more of these metrics in our plan in the next few days as well.
Next question comes from Drew with King 5.
Governor, we've heard about these benchmarks. I know we talked about the reduction of rates and death rates and hospitalization. You also talked about sufficient testing and the contact tracing system in place. Are we at all close on those last two issues with contact tracing and the sufficient testing to even talk about more openings?
Well, we're getting substantially closer. Those do not exist today, but we think we're making some good progress on that. As you know, we have been woefully short of test kits. The federal government has not provided us adequate test kits to actually test as many people as we want to test. We would like to test probably 4 times the number of people we're testing today as soon as possible. The good news is we have developed additional analytical capability to test those results. The bad news is we have not had enough swabs and viral transmission medium to be able to get the samples to the labs for analysis. Those have been severely restricted. Today on a call with the President and the Vice President and the Vice Admiral in charge of these matters, we were told that that supply will increase dramatically in the next couple of weeks. We hope that is the case, but as has been true in the past, we need to make sure that those things arrive. So we hope that that will succeed in getting us enough test kits to get the testing up to where we need it to be. Then we need the contact tracing capability to actually contact the people personally who these infected folks have had contact with. And then, and this is very important, and then make sure they are isolated and their families are isolated as well so that this can't spread like wildfire. We want to have 1,500 people engaged in that, a small army around the state of Washington. Our target date is by May 11th. We've made good progress on that. There has been substantial work done on the training, and we hope that training is going to start fairly soon for 700 members of the Washington State National Guard. We have folks for today in the local health districts, in addition to 200 additional people for Department of Health, and our plan is to try to recruit another 200. So those numbers together with local health will sum 1,500, even without the volunteers. So that is the plan. We're making good progress on it. But we're going to move very quickly. This is a very rapid pace of trying to stand up an army, and I'm glad we've committed ourselves to it.
Next question comes from Jim with the Sportsman Review.
The sport fishing industry lost the spring Chinook season in the Columbia River, and they told me it's when they make the money to help them through the winter. Will you be recommending the state aid for them and for other seasonal businesses that might not have a chance to make up for these restrictions when they're lifted?
I don't know the answer to that. Kelly, is there any particular plan?
We're working with the federal agencies now to develop whether or not we can actually get a disaster claim goal. And with these openings, we are reopening the Columbia River for spring Chinook. There'll be, again, the openings we would normally have, we have to do that in concert with Oregon and through the Columbia River Compact. So we're looking to ease the restrictions immediately, and we will work with folks to try to make sure that we can get some relief.
Next question comes from Hannah Scott with Higher Radio.
Hannah, are you?
Sorry.
Yeah, go ahead.
Can you give an update on elective surgeries, and also can you speak to the inclusion of Nevada and Colorado in the Western Pact? And I'm curious if you've seen Colorado's reopening plan, which kind of gives some specific dates and your thoughts on that.
I haven't seen the Colorado plan in detail. It would not shock me as states are different on these particular dates. They're going to make decisions specific to their states, so I can't really comment on them, except that Jared Polis, a really smart governor, and hope he's going to make good decisions. The elective surgery, we are trying to come up with a protocol that will allow some elective surgeries in a way that will make sure that they do not intrude on the personal protective equipment that nurses and staff and physicians need. And we're looking to a way that might be, and I repeat, might be able to be hospital specific, so that if hospitals could demonstrate that there is enough PPE, that elective surgery, at least some of it, could move forward. And we're working on trying to refine a protocol that might work in that way. We have not put any finishing touches on it. We're still talking to the stakeholders, to the nurses who have expressed some concerns about PPE, so that we can have something to give them confidence while we do reopen some of the surgeries, both from the revenue standpoint from hospitals, but obviously for people who'd like to get their joints fixed.
Next question comes from Jerry with the Everett Herald.
Governor, just a couple questions and maybe on your announcement today. First, do we know which parks, maybe 2 or 3 parks that are state parks, are going to open first? Second, given that some of the actions you said are data-driven, and it sounds like some things can happen right away, why is not more happening heading into the weekend? Why does it have to wait till May 5th if it's there? And finally, related to that is just some of us need a haircut. So when are the barbershops going to open? They can go fishing and golf. Why can't we go get a haircut?
When you tell me what date COVID will be substantially reduced in this state that allows us to increase the access to those services, I will be able to give you that date. But unfortunately, you can't provide that date. I can't provide that date. That's going to happen when we drive this number down small enough so that we can control this virus using contact tracing and isolation. And when we have the capability to do that contact tracing and isolation, that will be the date we make that decision. Now, those dates as to individual industries will probably vary depending on how much physical distancing they're involved in, what protocols the industry has helped develop to reduce the chance of transmission, and what the general circumstances are at that time. So going forward, we intend to turn this dial to try to find the first places where we can be safe and move up from there. And so I hope that that's sooner rather than later. As far as the parks, Don, do you want to take those questions?
Sure. I think by the end of the week, we can let you know about our parks. I'm assuming a majority of our parks will be open, but we are working with our local communities and our tribal partners to make sure that everybody's in sync when we open up. So I believe a lot of our day-use parks will be open.
And Don, Jerry, the reason you can't just turn it off in 5 minutes, turn it on in 5 minutes, is you have to get the people to come to work, get the schedule, get the maintenance done, make sure the hygiene's ready for people to get there, make sure the communication plan is in question. It's just not that simple. So they're actually moving pretty quickly, I think.
Next question comes from Keith with Toma.
Several states are opening up, Georgia all month. Are you going to restrict travel from states like that, whether they're flying in, driving in, and require them to quarantine days?
We don't have any current plans to do that, and I really hope that that will not be necessary.
Next question comes from Gregory Scruggs.
Hi, Governor Inslee and Commissioner Franz. One question and then a clarification. Have you had any conversations with our federal land managers about reopening developed sites at national forests and national parks? Do you consider the reopening of DNR land at state parks a signal that they should be considering similar steps in the coming days? And then the clarification for Director Hoch and Commissioner Franz, I understand that camping is prohibited. Does that include backcountry or primitive camping sites where you would not be using any developed facilities?
Don, do you want to answer that camping question?
Sure. Camping will be closed, and that's primitive and developed campsites, our group shelter campsites, and any of the other environmental learning centers that we have until we determine that they're safe and we get direction from the governor.
Hilary, I have not talked to the federal partners. Have you about this issue?
This is Commissioner of Public Lands.
Go ahead, Hilary. Hilary, did you get muted?
Yes, thank you. Appreciate that. First, I want to say, similar to state parks, all of our campgrounds will remain closed until further notice. As to, we are going to be opening up as many of our sites as fast as we We are working very closely with our federal partners. Obviously, we work closely with them as we are preparing and already in fire season, and we are also working closely with them since most of our land is adjacent to theirs, to make sure that we're coordinated on the opening of our lands with the opening of theirs, and making sure we're doing the same education and outreach to the public.
John wanted to add something. John?
We have been working with our federal partners, including national parks and national forests. One of the reasons we wanted to give 8 days before we opened up, because there is a lot of coordination that needs to go on there. But people also should be prepared to call ahead and make sure that the place they want to go is open, because some national park areas and some national forest areas will not be ready to go on May 5th, because they still have concerns and preparation that they need to do, or because they just have so much snow that they're just not ready to do it. So please call ahead and make sure that the place you want to go is open, and expect.
Governor, just to follow up to what you were saying about testing, saw that Admiral Giroir today said the Trump administration is prepared to send all 50 states enough tests to screen 2% of their population per month for the virus. I was wondering if that's a large enough testing for reopening things.
Well, I can tell you, I asked Admiral Giroir this question about Washington State, and he told me with no uncertainty that we would be receiving in the next 1 to 2 weeks the full complement of testing kits that we have requested. That would be wonderful when that happens. And I hope very dearly that that happens, because we want to reopen this state, and we've got to have that testing to be able to do it. Now, having said that, as we're making plans, which we are on a daily basis here, about what can reopen and what is not going to reopen, we have unfortunately learned from circumstance that some of those predictions have not come to pass. And we have to have high confidence when we make plans in this regard. So I'm going to be very hopeful, and that's not a reflection on the Admiral. I assume he's doing the best job he possibly can. But we have to have this substance actually do the work, and I'm hopeful that'll happen.
Governor, 2 questions for you today. You said earlier that you do have a plan for reopening and that the data is going to determine how you can go forward. Why not share that plan publicly, if not specific dates, then specific benchmarks that people can be aware of what's guiding your decision? And the second question for you today, we're hearing mayors across the state who feel frustrated. They feel like they don't have a say in the path forward and how the state plans to reopen and when. So what's your message to those mayors as they try to be leaders for their communities?
Well, we've been talking to mayors fairly regularly and listening to them. And our plan is, you're seeing it in part in operation today. This is not just a rhetorical exercise. We're actually doing our plan. Last week, we opened up construction, ongoing construction. And we did it because we were able to work with the industry to determine the protocols that would allow that to be done safely so that their employees would be safe. And that happened as part of our plan. Today, we are taking a second step to open up outdoor recreation, or a significant part of it, again, after thinking about some of the protocols for weeks of figuring out how to do this in a safe way. Now, going forward, we are going to be looking at several more industries, and the date they can open depends on multiple degrees of metrics. And I'll spend an hour with you, maybe Wednesday, talking about more of those metrics. I just showed you 2 of those today. Now, besides the epidemiological metrics that we look at that will trigger this reopening, that will give us the green light, they also include the status of our healthcare system to make sure that we have enough surge capacity available in the event that this virus took off again. That is a very important metric that we judge locally of our 90-plus hospitals. We are also looking at, obviously, the ability of our testing, contact tracing, and isolation facilities to do the job. So that's a metric of looking how many people we will have when that are fully trained and functional to be able to do this job. That's a metric that we look at. Not one of these metrics is dispositive, and it would be so easy. This job would be so easy if there was one metric that I could give you that would be the only one we look at. But it is a combination of all of this epidemiological evidence, all of our assessment of the hospital situation, all of our assessment of the contact tracing, isolation, and testing protocols, including when we're going to get the test kits that have been promised to us by the federal government. And you have to consider all of those together. And when they reach the point where we're highly confident that we can reopen our society and not suffer the fate of New York, then we will make a decision to do that as soon as we can. That's what we can say today, and that's what we've got to be guided with, what we know today. And what we do today is we can open up outdoor recreation. So this is not just some kind of wishful thinking. We're actually taking action on our plan. It's the first two steps of many.
Next question comes from Dan with Fox.
Governor, can you get specific on some of the data points, the number that you're looking for? I give an example of in New York, the governor there said that the effective reproductive number was at 0.8. The Institute for Disease Modeling actually had Washington State's number, actually the Puget Sound number, back on March 25th at 0.75. So a lower number than what New York has now.
Do you have the curve, that graph?
Procedures in their hospitals that they haven't been doing, that they've been putting
Of
off because there's so much capacity.
The IDM?
About the same number of people showing up with COVID symptoms as you did back in early March. So can you get very specific on what your data points, what numbers you're looking for example, in the RE or in the hospitalizations? What are you looking for specifically in numbers?
Yeah, I wanted to show you a couple, and again, this is going to be a compilation of numbers, not just one. There is no one number that we are going to look at. It would not be responsible to look at just one number. And we're trying to get a graph up from the IDM that you're referring to. No, I was looking at the other one. Do you have the R naught graph up? Well, there's a different one anyway. Okay, I'll have to show you some graphs another day. Okay, so the R naught number, this is the number that determines how many people are infected when one person gets infected. We do not have adequate testing right now to determine that number outside of the King County area. In King County, the most recent number we were given was just maybe below 1, just for King County. We do not have a good enough assay outside of that region to figure out where that number is. And I believe it's going to have to be substantially lower than that to open up our society on any reasonable basis. So that's just one of the things we look at. Then we look at the percentage of tests that come back positive. I think our latest number is, 7.8%, as I recall. We need to get that number down. We look at the modeling itself, including the model that I just showed you a little earlier. And that projection is that this will remain in the best county, which might be King County right now, or Snohomish County. At the best, we just get some small gradual decline, which isn't enough for us. That gradient has to come down significantly before we are in a position to feel safe to reopen again. And that's just an epidemiological fact. Now, there is another model from the Institute for Health Metrics. That model, in a sense, is more optimistic. It shows it predicts a more rapid decline down to very, very low numbers by the end of May, assuming that we continue our social distancing. So we need to know that those numbers are down. We also have to make sure that the number of hospitalizations get down extremely low, because that's what predicts fatalities and predicts eventual potential surge in your hospital. All of those numbers have to be dramatically lower than they are today in order to be able to declare success and then switch to our second phase, which is the contact tracing phase. And I want to reiterate this. It is not enough for our health and our safety to just end social distancing, because there is always going to be some level of infection in our midst to some degree, in part because even if we totally eliminated it in Washington State, people will visit from other states, just across the river from Portland, for instance. So we have to have a very robust contact tracing, and that means that we have to have enough to find that person, test them very rapidly, get them the results, reach an agreement with them about how they are going to isolate themselves and how they're going to isolate their family. And this is not easy work. It means a whole family will have to be isolated for 2 weeks. And helping them manage that takes a lot of people to do that. Then we also have to have people to go to everyone they've met for some period of time and get those people tested and have the same regime for them. So I think you can see this is an enormous undertaking, and when we get that stood up, that's another metric that's extremely important.
All right, last question. Last question is from Tom with Public Radio.
A question for Don and Kelly. Can you talk a little more about the concerns you've heard from the Washington coast that lead you to keep state parks on the coast and clam digging closed? And what would need to change to open those?
So Kelly, why don't you start?
Right, sure. So there's a couple of things there. So on the marine fishing, we have very limited access out there, and most of those boat launches are closed. And we want to make sure when people head out there, they have a place to go, and then we don't create a congestion in those closed areas. We're also working, as you know, this for us all started with razor clams, where you might have 10 or 20,000 people going through those small communities on their way to the beach. We're working with them to make sure that they're prepared for an opener, should we be able to get to one. And we're working with all of our partners to try to make sure that the access to boat launches, et cetera, is open. That includes tribal partners, where several of the typical tribal access points are also closed.
State parks are in the same condition of Fish and Wildlife. We'll be watching our seashores. We'll be working continuously with the counties and the cities on that. They have expressed a concern about parking on roadways, large gatherings around their community areas. So we'll be working with them to instill some ways to hopefully prevent some of that. But we'll open up our beach parks as soon as we get that all worked out, and hopefully that'll be fairly soon.
All right.
One moment, I just wanted to add something. The gentleman from Fox News asked a question earlier about metrics, and he made some reference to New York. I hope you understand New York is not opening up New York today, even though their R-naught number may be under 1. And the reason Governor Cuomo is not doing that, as he understands as I do, is that could be disastrous in his state. Now, there may be some things that can happen on the margins, like we are taking place today. But no one, I don't think, in his administration is suggesting that that would be a good decision. I also want to point out that we do not have an R-naught number for the rest of the state of Washington. We believe it is likely over 1 by some significance, and that's based on some of the hospitalization data that we have. So, and the third point I would make out is, look, the things we're doing have by necessity have criticism and controversy. They're very difficult for people. It's really hard isolating. It's really hard not being out of work. And so criticism is to be expected. But no one is proposing a date to reopen this state that I've heard. They just kind of carp on our plans. We're making data-driven decisions. I'm glad we're doing it. And it's based on confidence that Washingtonians are going to succeed in this very noble mission. And I appreciate it. With that, Tara, are we? All done. Okay, thank you. Wash your hands.